Okay, Greg, we're broadcasting live.
Okay, we're all set, and you're letting people in, and we can see the numbers are increasing, and so we're ready to start. So good evening, everyone, and welcome to the Norwalk Town Hall on the state of the COVID-19 and a focus on the Norwalk Public Schools system. Tonight's Town Hall is brought to you in partnership with the Norwalk branch of the NAACP, the Norwalk Public Schools, and the City of Norwalk. My name is Greg Burnett. I am on the Common Council and also a member of the Norwalk NAACP, and I will be your moderator for tonight's Town Hall meeting. Members of the public can participate by entering questions through the chat feature, which is available on the bottom of the Zoom screen. Simply click on the bubble icon over the Q&A on the bottom of your screen, and that will open up a dialog box so you can type in your question. Questions from the public will be presented to the panelists throughout the town hall meeting. The town hall meeting is also being recorded and will be posted on the city website for future viewing. The town hall meeting, in addition, will be translated in both English and Spanish. Excuse me, it will be in English and Creole. This is a feature that we're providing tonight. And for those who wish to take advantage of it, you simply click on the interpretation button on the bottom of your Zoom screen and then select either Spanish or French, and the French will have the Creole interpretation. Again, if you wish to submit a question, simply type the question into the Q&A as opposed to using the raise hand feature. At this time, we'd like to introduce our esteemed panelists to start our town hall meeting, starting with Mayor Harry Rilling, our Norwalk Public Schools Superintendent, Dr. Alexandra Estrella, Norwalk Branch President of the NAACP, Brenda Penn-Williams, Norwalk Chief of Community Services, Lamont Daniels, and Norwalk Health Department Director, Deanna Diamore. We also have joining us this evening, Norwalk Public Schools Chief of School Operations, Dr. Frank Costanzo, Ralph Valasisi, who is the Chief of Digital Learning and Development, Brenda Williams, who is the Chief Communications Officer, and Joanne Malinowski, who is our Health Services Coordinator for the Board of Education. Thank you to each of the panelists for joining. And we will now start with some opening comments, starting with Mayor Rilling, followed by Dr. Estrella, Ms. Penn-Williams, Mr. Daniels, and Ms. Diamore. Mayor Rilling, well, I'm getting tongue-tied tonight. Mayor Rilling, welcome. If you got to unmute.
Okay, how's that? Is that better?
Perfect.
Okay, well, again, thank you, Mr. Burnett, for moderating this event, this town hall. I'd also like to thank the NAACP for bringing about this this town hall. It's critically important that we communicate to the public in every way we possibly can. We know these times are tough. We know that things have gotten worse over the past several weeks, worse than they were at the beginning of this pandemic. So we need to do everything that we possibly can as a community to make sure that we keep our citizens safe and healthy. That is and always has been my priority, and I want to make sure that we continue that. The city of Norwalk is doing so many things. You'll hear about them tonight regarding testing, regarding food distribution, information dissemination, all the kinds of things that we can do to ensure that our community is getting the information it needs, that we are providing testing services, and that we are also helping them find resources during this very difficult time. I'd like to thank Dr. Estrella and her staff for being here as well as my staff, Lamont Daniels, Chief of Community Services, and the Director of the Health Department, Deanna Diamore. They both are working extremely, extremely hard on your behalf, and we look forward to answering your questions. So thank you.
Thank you, Mayor Rilling. Dr. Estrella.
Good evening, everyone. Thank you for being here today. I'm looking forward to today's conversation to address some of the questions that the community might have regarding our schools and the work that we're doing to ensure the safety and well-being of students and staff as we continue to educate our students throughout the midst of this pandemic. And I want to thank Mayor Reeling and his team for supporting us through this process and being active partners as we engage in the work of educating our children. I want to thank Dr. Costanzo, Joanne Malinowski, Brenda Williams, as well as Ralph Valencisi for joining me today and engaging in the dialogue of how we're doing the work to ensure that our students are successful in the midst of this pandemic. So thank you for being here tonight.
Thank you. Brenda Penn Williams.
Okay. Good evening. Welcome to the City of Norwalk Town Hall. I am Brenda Penn Williams, President of the Norwalk NAACP. The topic of tonight's discussion is COVID-19 virus. And how it's affecting our schools. I have received many calls from the community members, teachers and staff at the school throughout Norwalk that are very worried about the current state of our schools. We know that everyone is doing their best and we have all the best interests at heart for our students. The schools are short-staffed. Some have temporary closed. Some schools have a very few students in the building. And people are worried and fearful of contracting the virus and taking it home. Tonight we have, and they have already been introduced, but I'll reintroduce them. Mayor Harry Reeling, Superintendent Dr. Alexandria Estrella, along with her cabinet, Health Director Deanna Diamore, Lamont Daniels, he's the Chief of Community Service, and Greg Burnett, our moderator. Thank you very much. Again, Greg, you can begin. Thanks.
Excuse me. Thank you, Brenda. We'll now go to opening statements from Lamont Daniels.
Good evening, Norwalkers. It's my pleasure to be with you this evening. As your Chief of Community Services, I want to first thank our community partners who are here to assist and help you understand what supports and resources are there for you. I look forward to having the conversation. I look forward to responding to questions, and we continue, as the mayor said, to support you during this time. Thank you.
Thank you, Lamont. And now we'll go to Deanna Diamore.
Good evening, everyone. Thank you, Greg. Thank you, Brenda, for inviting me here today to be on this panel. You know, it's an extremely hard time for everyone right now. And I have to say, just thank you to all the community members for all that you're doing to keep yourselves and your families and your loved ones safe on these trying times for all of us. And I'm just really honored to work with everyone who's on this panel, to work closely with everyone. It's a team effort. It's a whole community effort to combat this pandemic. So thank you, everyone, and thank you for all that you're doing.
Thank you, Deanna. We will now move into questions and responses. And again, we have close to 500 people on the call right now, which is fantastic. So again, if you wish to submit a question, please just submit it through the Q&A feature at the bottom of your Zoom screen. But we'll start with a question first. And this question is focused on the decision-making process. And we'll start with Mayor Rilling and Dr. Estrella, your input on the question first. As recent as today, in New York City, public schools were closed down. However, restaurants and businesses currently remain open. What are some of the critical factors that are considered when deciding to close or suspend schools and businesses?
Well, I'll start out with the issue of businesses. It's very challenging because many of the businesses, when we first went into what I would call pretty much of a lockdown, with restaurants being closed and service businesses being closed, they struggled. They weren't able to pay their rent. They weren't able to pay their employees. A lot of people lost their jobs. A lot of people who lost their jobs or who were laid off have not come back. So it's a big challenge to take and close businesses right now. But what we do is we constantly monitor the situation and we look at what the state is doing. The state just moved into a 2.1 phase, which is a little bit of a modification of the old phase 2. Rather than roll back all the way to phase 2, they rolled back to phase 2.1. And you can get information on what that means on our website and on the state website regarding what the restrictions are. So we constantly monitor the situation, try to determine why we are having an increase in cases, and if we can identify any commonalities as to where the cases are occurring. For instance, indoor dining, beauty salons, barbershops, large stores, wherever we can find commonality, we constantly monitor, and we try to make sure that we make the decisions we need to make. Dr. Estrella and I meet on a regular basis and discuss the situation in the schools, and I'll let her continue talk about the school situation. But just know that in the city, we are monitoring the situation on a daily basis. We talk to our chief of community services. We discuss this with our director of health, and we look to determine what we have to do in concert with the state of Connecticut, what they're planning on doing so that we can protect our city.
So like Mayor Rilling said, we have an active partnership in this work. Deanna Diamore is someone that we constantly engage in conversation and looking at positive cases, looking at trends and patterns within the community and the impact of those trends and patterns in our schools. We really focus a lot of our decision on data and what we learn about each case on a case-by-case basis, because there are multiple factors that we have to take into consideration to determine whether or not we should close a school. And in many cases, it's been less about the number of positive cases and more about the fact that we don't have enough staff to cover the school in a safe manner to fulfill the programming needs for students. So I'm gonna have Joanna Malinowski speak a little bit about the contact tracing process that we engage in to first determine who we need to quarantine within our schools. And I just want to state that even when we engage in the contact tracing, we are very conservative in when we identify who needs to quarantine, because when we look at the CDC guidelines and the state guidelines, the idea is that anyone that is within 6 feet should be quarantined if the person is positive. And we go beyond that. If we have a positive case in a classroom, we decide to quarantine the entire class because we want to make sure that there is no risk in any situation, in any decision that we're making. We try to limit any mitigating concerns that might arise because someone is positive within our schools. But I'll turn it to Joanne Malinowski to speak specifically about the process we take. And also, Joanne, if you can speak a little bit about second exposure, which has been one of the things that many parents have had questions around.
Good evening, everybody. I'm doing the contact tracing with Deanna Diamore and her team. We collaborate with the health department every day, 7 days a week. We get our positive cases from the health department. That's reported from the State Department of Public Health. We also get our positive cases from either staff members with a laboratory result and or principals or teachers where a parent may have called in to report that their child was positive. So we are working pretty much 7 days a week and many, many times, you know, up to 9, 10 o'clock at night, all day, depending upon how many cases we have. When we get that information, what's the purpose of contact tracing? Why are we doing this? The idea is to keep everybody safe. That's what we're doing, because we want to stop the spread, stop the transmission, whether it's in our schools and in our community, whether it's our staff, our students, our buses, our athletics, all over the community. That's really what we're trying to do. And that's how we can flatten the curve as best we can. Right now, we're in a red zone, and it's been quite an uptick at the moment in all of Connecticut, actually. But what we're doing is actually getting the information. When we have a positive case, the first thing we do is look at the dates. Very important. Was the student or the staff member in our schools? When were they in our schools? When were they symptomatic, or were they symptomatic at all? If they have a positive result. So now we look at whether that child is in the classroom or the staff member, if they're on a bus, if they're in a before or after school program, and then we have to trace everybody that has come in contact with that particular student. And as Dr. Estrella said, we are taking a very conservative approach. I have meetings all the time with other districts, and people are doing it a little bit differently. You know, it's almost like you have a source, one person that has the positive result, and then maybe 3 or 4 children around them that may be 4 to 6 feet apart, which is the recommendation. They would be quarantined. But instead of doing that, we're doing the entire classroom, because they're children. We cannot ensure that the child that's sitting in seat 10 is not next to has not walked by for 5 minutes, or children get up and move around. So we can't guarantee that. So that's why one of the reasons we're ensuring that everybody is quarantined in that classroom, as well as staff and anybody else who comes in contact with those children or staff members as well. So we get that information. We actually call every single family when we quarantine. Quarantine means that you've been exposed to a positive case. So when we call a family member, we say your child or a staff member has been exposed and you need to quarantine for 14 days. Let me just say that you cannot test out of a quarantine. And most people don't understand that. The reason being, it's an RNA virus and it replicates quickly, and it goes on for 14 days. And the more viral load, the more you have in your system, that's what actually produces the virus and makes you sick with symptoms. So you cannot test out of it. If you are exposed to somebody and you wait 3 days and you say, oh, I had a negative PCR test, you cannot test out of that quarantine, because on day 14 or day 13, you can have a positive test. You know, you may be fine for 2 weeks or 10 days or 12 days. And I hope everybody is. And actually, we've had very good results with that. That's another key piece. We haven't really had people getting sick during the quarantine. Not that many, very few. So that's another step that we take. And then if somebody is sick, the person who is sick, isolates. It's really a case-by-case basis when you talk about isolation. You know, a high school student or an adult can actually stay in a room, in a bedroom, have their own bathroom, and isolate themselves for the rest of the family. But when you're a mom or a dad and you have a 2 or 3-year-old child or a 5-year-old child, you can't isolate from that child. So it's a different set of circumstances in those respects. So when we notify everybody, we do look at the bus. Everybody on the bus gets quarantined. If you're in athletics, if you played field hockey, and you were on the field and how close you were. I mean, it's very difficult to do that when you're doing athletics. So we just quarantine the whole team, and it's just easier to do that and more safer for everybody, and to ensure the community is safe as well. Because when you have the virus, if you have it, you're taking that home to everybody in your family if you're positive. And then you get into all the elderly people and grandma and grandpa, et cetera, and it's just not a good situation. So that's the quarantine. So now you get a phone call to explain what the quarantine is. And here's the question about the secondary exposure. And this is the most frequent question we all get when we call families. What does that mean for me? Why do I have to quarantine? Can my other children go to school? I don't understand this. How come my kids can go to school, but my second child that was exposed can't go? I don't get it. How come we all don't have to quarantine? Well, here's the answer. Do you have a positive case in your house, or do you have a child that is quarantining due to an exposure to somebody else? That's the reason why. So if one child is quarantined and you have siblings, those siblings go to school like they normally would. Mom and dad go to work, grandpa, whatever. You just carry on your normal activities. And then if anything changes, if the child that was exposed becomes positive, that's a different set of circumstances, okay? So that means you now have a positive case in your household, and that changes the whole picture because now everybody has to quarantine. And by the way, you should seek medical evaluation, call your doctors or your providers, and also if they recommend testing and you're symptomatic, that's the best time to do that. So we allow people to come back after 14 days. We have that in our Power School, in our database, so that we can keep tabs on everybody when they're coming and going, and to ensure the safety. We also have Spanish speakers and a Creole person also, if we need to, that would be able to call families when and if that person needs to be quarantined, so that everybody is clear on what the necessary steps are to keep everybody safe. I cannot stress enough, wear your mask, stay 6 feet away, wash your hands. And this is all we tell people. Please, it's very important, use hand sanitizer. The other thing I want to just talk about for 1 second, and I don't want to monopolize this. I know I talk a lot, I'm sorry about that. But the travel advisory, I just want you folks to know Thanksgiving is coming up, and the new travel advisory from the state of Connecticut comes out every Tuesday. Every Tuesday, Governor Lamont sends that out. So please look for that. And if you do travel to places that require quarantine, you must do so. It's a 14-day quarantine. Thank you very much.
Thank you, Joanne. Deanna, we somewhat moved into the discussion on quarantine. Could you possibly touch on that, and also the importance of contact tracing?
Sure, Greg, happy to. So there's quarantine versus isolation, as Joanne has been talking about. So a quarantine is for somebody that's been exposed to someone else who's positive. So what contact tracing allows us to do is it's to identify who has been within close contact of somebody who has been positive. And so, as Joanne mentioned, that helps us really stop the spread, because if someone has been within close contact of somebody, they should be quarantining for 14 days within their own home. And not being around other people. And during that time period, if they happen to develop symptoms, they happen to develop the virus, if they've been quarantining within their own home away from others, then they wouldn't have the opportunity to infect somebody else. So that's why it's so important to do the contact tracing, so you can identify who's been in close contact, who could potentially become sick, so that that person can unknowingly make somebody else sick. Isolation, just in comparison, is for those who are sick. So that is a 10-day period typically. Quarantine is actually a longer period because it can take 2 to 14 days to develop symptoms to become sick after being exposed. So quarantine period is for 14 days, and the isolation period, based on research that's been done at the CDC, it's you're considered infectious up to 10 days past either the development of symptoms or a positive test if you haven't, if you don't have any symptoms.
Thank you. There's quite a few questions coming in through the Q&A on the topic of why sibling, on the same topic of quarantine and contact tracing, why aren't siblings required to be home as well? I don't know if Joanne or Deanna, you wanted to touch on that.
So Joanne did talk a little bit about that, so I'll just expand on it. So it's like we mentioned, second exposure, it's the contact of a contact that everyone always asks about that question. So if a sibling, if someone's sibling has been a close contact, that person needs to quarantine because they've actually been in contact with somebody, they've been in close contact with somebody who's been positive, but that sibling has not been in close contact. If that sibling who's been a close contact develops symptoms, is not feeling well, that's when you know that that sibling should stay home. But at that point, contacts of contacts do not need to quarantine. We're really focused on who has been within close contact of an actual, positive person.
Okay, Joanne, any comments, or anyone else have any comments on this particular area? Okay, thank you. We'll move on to another question, which is related to remote learning. And Dr. Strayer, we'll start with your response. Currently, some of the student learning is in school and some is remote. In the event that we need to temporarily transition back to full remote learning, what plans are in place to make sure that instruction continues without interruption?
So one of the things that we have advised all of our staff is to make sure that they're prepared to transition on the blink of an eye, basically. So all of the students in the district have devices from pre-K to 12, as well as every staff member. We also have some partners that we've been working with. The city has been involved in this initiative, and I can have Ralph and Lamont speak a little bit about that initiative, because it's not only about the devices, but the connectivity and access to the internet that becomes crucial if we need to transition to full remote. And I think it would be good for them to speak a little bit about that work in the case that we have to transition to full remote. Ralph, would you like to start? And I don't know, Lamont, if you would like to speak to it as well.
Sure, definitely. And, just to kind of elaborate a little bit on Dr. Estrada's explanation of the technology. So thanks to the Dalio Family Foundation and also to the mayor through our capital funds, we were able to move to a K through 12 one-to-one initiative, as well as making sure that all teachers have devices in the district, including our NECC pre-K students at this point. So we really are fully covered with devices that can be taken home, so that then we can continue the learning the way that we're doing this. Our models, and I mean, I can talk a little bit later if you'd like to the instructional model and how we're approaching this. We've made sure that as we've been training teachers, the model that's being used internally in school is it transitions directly to a virtual model for students. So the fact that the teachers are working with the same students at home as well as in their hybrid models, when they actually, if we do transition to fully remote, the learning keeps going on the same way that it's actually occurring currently. So we are able to do that. Getting back to the technology though itself, so we have K through 12 devices for everybody. We have devices for all of the teachers, but devices aren't enough. Really, in order to make this equitable and to make sure that all students have access, we need to make sure that they can connect with these computers. And knowing that hotspots many times are not good enough, we're looking to make sure that every student has the best quality internet that they can. And through a generous donation from the Dalio Family Foundation, we have been providing internet access for families that need that service. And I got to say, it's like working with Lamond has been a pleasure on this whole project. And it's truly a partnership between us and the city and our other local partners, where you know, in the discussions around this, and Lamond, you can jump in please anytime on this, but the idea that, you know, obviously if there's a need for internet access, there's probably other needs too as well. So you know, with the work of Lamond, and I feel like we've been talking almost every 8 hours lately on working on collaboration between the two departments. But he's actually working so closely now, including with he just met with our principals about making sure that, and he can tell you a little bit about our community navigators, which is a secondary portion of the grant that we received, so that it's not only internet access that they need, they may need other support services. And that's really what we're making sure is we're trying to do that wraparound service for all of our community members. So Lamond?
Yeah, sure. Great. Thank you, Dr. Estrella, Mayor and Ralph. I want to start by saying, I want to urge those that are listening, if you know of a family or you yourself are having trouble with internet connectivity, please let your school know. We are coming into contact with families who have said to us, I don't want to share this personal information. We want to make sure that whatever happens, you have the tools so that you can connect online, and be successful. I often used to say, help is not a bad word. My second point is, through this program, we are able to offer what we call a family navigator that will reach out to you and basically ask, how can I help you beyond the school? We know that many of you, and you may know of other families that need help with food, helping understand what resources are available. Through this partnership with the school, through the Dahlia Foundation, we have been able to hire additional staff on the city side to be that mentor to families. And so for those that are watching, whether it's you yourselves, I'm asking you to do like a neighbor to neighbor. If you know of a neighbor, say, please, the school and the city has resources for you. We're looking forward to working with you. We want to help you. We're all struggling during this time, but you don't have to do it alone. So please, after today, as Ralph indicated, we've already met with the principals. The principals are aware of this initiative. Please call your school and you can say, I heard it last night. There's help. And there really is. And we're working to manage their requests because we know they're starting to come in, but that's okay. That's our responsibility. More importantly, I need your help to say I need help. So we're looking forward to working with you and your families and your children. This resource is available, and please call the school so we can support you, and we'll make that call to help you. Thank you.
Great. Thanks, Lamont. And just a couple, if I can make just a couple more comments on what we're really doing to make sure the remote learning will actually be successful in the case that we are fully remote. One of the things we have in place right now with our middle schools and our hybrid learning model is we have learning pods that are set up in partnership, once again, with the city, as well as some of our community partners like Family Children's Agency and the Carver Center, where students that are in that hybrid model, if they do need a place to go, some of those those middle school students go there, and we actually have a tutor that's actually sitting there with the students, making sure that they're connected into their classroom. Those tutors are also manning an online help desk for parents from 8 to 3. And that's posted, those links are posted on our website. It's a Zoom meeting, just like we're in right now. Parents log in on a regular basis. They say, I need a password reset. I don't know how to use, what is Power School? What is ClassLink or Google Classroom? And we have people there that help support them to explain to them what's going on. So we're trying to make sure that the parents are also able to get the support that they need to support their children at home. And then finally, really, we've made sure to, in the case of the technology, if things do break down and there are replacements that are needed, we will have depot centers set up. Back in March, we had our old Norwalk Pathways Academy, or the Briggs building, and that's where it will be again, where parents can schedule a time to come in and get a replacement and swap out a Chromebook if there's something wrong with it, so we can make sure that they're actually, students have devices that are working, and then we can kind of clean up the device and make sure that it actually is back into circulation soon enough. And finally, we've also developed, if you go on to mps.parentuniversity.org, we have a series of workshops that are there for parents that were webinars but are now taped and actually available for parents to be able to see, both in English and Spanish. On how to be able to, everything from how to be able to support your student with literacy to how do you use a Chromebook. So there's really a number of different areas there that's available for them. And we've done the same thing for our teachers to make sure that they have a digital learning platform with a lot of online videos and tutorials with all of the tools that they use to do their instruction.
Great, thank you, Ralph. And any other comments? One of the, we have several questions coming through from the participants. Several questions are coming in on the topic of testing. Testing in schools, are we thinking or have any plan in place for random testing in schools? And just the overall testing protocol. So maybe Deanna, you might start the response with some information related to testing and some of the things that we're doing related to that.
Sure, and Lamont and Mayor Willing, please chime in as well. So we work really closely with all of the testing partners, all the healthcare providers. We meet on a weekly basis with them to talk about, give each other updates. But testing is certainly one of the really important things that we've been working on. And we also work very closely with the governor's office on testing. And ensuring that we can bring testing resources into Norwalk. So the governor's office has been a tremendous support to us to bring additional resources into Norwalk. I just want to give a special thanks to Community Health Centers Inc., Day Street Community Health Center. They have been doing a lot of testing for Norwalk residents. They've really, we have to thank Norwalk Hospital, we have to thank Norwalk Health Center, we have to thank there are some private docs that are doing testing. There's CVS, there's Walgreens, there's urgent care centers, but Community Health Centers Inc., Day Street has been doing most of the the community testing and the pop-up testing. So really, they deserve a special thanks for all that they're doing. But we know that there is a huge demand, right, for testing. We see it all throughout the state. And so we're continuing to look for additional opportunities to bring more testing into Norwalk. Lamont, I don't know if you want to add anything.
Yeah. Just defer to the mayor if you wanted to, or you want me to just go ahead, Mayor?
No, go ahead. I think what you need to talk about a little bit is about some of the places we're looking at.
Yes, sir.
I know there's testing tomorrow, Saturday at Brian McMahon High School. But talk about the resources and talk about the need for staffing. That's
certainly,
important.
Absolutely, thank you, Mayor. Definitely echo Deanna. So even today, we had a conversation with Mayor Rowling, mentioned this, and I think it hit the press. Even today, the National Guard was out there. So those that may have participated at the Veterans Park, we hope that you felt it was a little faster, recognizing the volume is still high. I myself, I've been out there just about every day. So I see the concerns, I see the worries, and I'm very aware of the wait lines. So through Mayor Willing and the partnership with the state, we have been able to deploy National Guard there. So they're helping. So there's like 15 people out there today. And also to the point that Mayor Willing mentioned, Community Health Inc. is hiring. They need people to help. The volume is so high, they are hiring an additional 20 staff specifically for Norwalk. It's been promoted on our website, and we can re-promote it again and get it out to the community, that for those home from college or just looking for some work to do some data entry, we'll keep you safe so you don't have to worry about the COVID. This is more about the data entry and technical piece. We encourage Norwalkers that if they're looking for employment. We're also working with other providers. They have asked us not to disclose their name publicly yet, but we are looking to expand full-time testing at the Norwalk College campus. To Deanna's point, we're looking at other community providers. But here's what I want you to know. The majority of the state is red. And so the entire state is looking for these resources, similar like Norwalk. So we're all coming together, seeing how we can deploy. So the state is working to give us the resources. We need trailers. The winter season is coming. The reason why we cannot go inside, because it creates a whole different protocol with filtering, and the ceilings have to be a certain height. It's not just open up a site. But I want Norwalkers to know that through Deanna's leadership from the health department, the mayor, and our partners, we're working diligently every day to identify locations, to identify partners, and to identify key places where we can set up the testing. So I'm just asking you all to be patient. And if you're going to Veterans Park, will you just consider say thank you to those that are out there every day? They're on the water, so it's very, very cold out there every day, but they're committed to provide these services to us. Through Mayor Willing and Deanna, we've asked, we've advocated, and we were able to get the Veterans Park open. However, we know that there's a need and we know the volume is increasing, but we are working diligently to continue to identify staffing. And just over the next couple of weeks, we hope to announce some additional sites and some additional long-term sites to be deployed here in our city during the winter season up into next year. Mayor, did I cover everything, Deanna, Mayor?
You did, Lamont. We're also looking at perhaps Norwalk has a formed emergency response team made up of volunteers who are trained and designed just to do these kinds of things. So we're hoping that we can get the emergency response team members available to help with the dissemination. And we know that this is a practice, because when the vaccine comes out, there's going to be a demand even far greater, 10 times greater or more than the demand for the testing. And everybody is going to be in line to get the vaccine. So we really have to prepare for that. But this is pretty much a practice for what we're going to be experiencing come January, February, March, whenever we're able to get the vaccines out.
Greg, can I just add one other point related to
Absolutely.
testing?
Yes,
So
please.
we know how important testing is, but I just want to remind everyone that you can test negative one day and you can be positive the next. So while testing is really important and we want to know our status and we want to be able to control the spread, we just want to remind everyone that even if you have a negative test, that's not an okay to not wear your face mask or face covering while you're out in public when you're in close proximity to other people. You still need to wash your hands. You still need to stay home if you're not feeling well. So just everyone needs to remember washing your hands, keeping your distance, and having that face covering and face mask. Thank you.
Just one quick thing about face masks, Deanna or Lamont. Originally, we were told that face masks prevent you from giving it to someone and that they did not protect the wearer from contracting the virus. That has completely changed now. Wearing a face mask also will help prevent you getting the virus and not just giving it to someone else. So please, the face masks are so critically important.
And make sure you cover your nose. Because I know people put them here in the proper way. Cover your nose, because your nose is a gateway, so you can still inhale.
Great.
And
Still on the topic of testing, and maybe Dr. Costanzo, might be able to shed some light on. There's several questions coming in about testing within schools. What is the thinking around that approach?
Good evening, Greg and everyone. The superintendent and I have been in conversations with Deanna about this very point. I think we spoke about it last a week ago tomorrow. There isn't right now a test that we could make available on a regular basis for asymptomatic individuals. When we spoke with Deanna on Friday of last week, we were strategizing the potential to have on Friday mornings before school starts a testing set up at each school for any employee who felt as though they wanted to get tested on a volunteer basis. But in talking with Deanna, that particular approach would really only work if the individual were symptomatic. And we don't want to have symptomatic individuals coming onto the campus to take a COVID test. So to date, we don't have a plan to institute any testing at any of our schools. There are 2 districts in the state, Greenwich and Middletown, that are incorporating a pilot method of testing. But to be able to do it at scale in Norwalk is not something that we have planned in the short term.
Thank you. Any other thoughts as it relates to testing? There's quite a few questions coming in around that that area of testing, which obviously is extremely important. And we want to make sure everyone is totally aware of what the strategy is and what our position is currently in terms of getting testing out to the community.
Greg, if I can just add, so what Frank was referring to is some of the antigen tests that provide that rapid result. Those are really designed for people that are symptomatic. So that's just a reminder for folks that if they're going to get a rapid test, at an urgent care center, they want their results. Those are really most accurate for people that have symptoms. So if you're just wanting to know if you've been in close contact with somebody and you have no symptoms and you want to know if you're positive, you really need to get a PCR test. You shouldn't be getting a rapid test, that antigen test, unless you have symptoms, because it's, it's really not designed for people that are not exhibiting any symptoms. Thank you.
Thank you, Deanna. This question is related to resources, and I'll start with Mr. Daniels. I mean, obviously, COVID-19 has affected everyone in some shape or form. What programs or resources does the city and the school district have in place to support families who are struggling during COVID? And how can people access those services?
Find my mute button. Hi, that's a great question. So there are a variety of resources here in the city of Norwalk. One I will say is I will encourage residents to use the 211 number, and it's literally 211, and access the information for the city of Norwalk. I personally reached out to 211 yesterday to make sure the services offered in Norwalk are current and are available. I would also encourage, and I kind of alluded to this earlier, is this is a time where we have to think about neighbors helping neighbors, families helping families, and people helping people. So again, to those that are on today's call, if you know of the organizations that are helping, share that with your neighbors, share that with a friend. I want to highlight a few. Person to person, please reach out. They provide food and a variety of services, also rental assistance. There's also one department that's in the city that's been highly used is our fair rent department. Many families are telling us that they aren't able to pay their rent for a variety of reasons. Well, there's support there. There's executive orders that landlords have to abide by. And Greg, I don't know, I have every number with me. I don't know if I should give the numbers out or just draw folks to our website, which is Norwalk CT /City News. but we encourage those to reach out. But I'll give you the fair rent number because that seems to be a department that's pretty utilized every day. And that number is 203-854-7989. This is specifically for tenants. If one, you can't pay your rent because of COVID, because of loss of job, or two, you're having some challenge with your landlord, you have rights. And the city has a resource for you to reach out that you can call and support. And so there are a variety of resources in the city of Norwalk. I mentioned person to person, community action agency. But if you would go to our website, norwalkt.org/city news and click on the hand button, you'll see a hand with a heart. We've listed all the support services. But I would also encourage folks, get prepared now, because we don't know what the future is going to hold. Prepare yourselves. Start writing down, if I need food, where do I go? Google it, talk to friends, talk to neighbors. Many of you use our Facebook and our social media. We will continue to do our food programs. We served over 2,000 today. We will continue to do one more large Connecticut mass food bank program. We served over 1,500 cars, joined with Mayor Willing and Councilman Gregg. So those of you that are getting information, what I'm asking you, for those that may not have internet connection, will you pass it along? Will you let them know that, hey, just wanted to make you aware that today there's a food program. Hey, I want to make you aware this is a number because this is where we need all the community to come together to share information, especially those that may not have access to internet in the way we use it today, or may not have limited access. So I think, Councilman, what I would encourage people to use our website and also be a friendly neighbor and share information as you learn about what resources are available in the city.
Great, thank you, Lamont. Anything to add from the Norwalk Public Schools as it relates to the services that are being provided and resources to students, parents, etc.?
So I'm going to have Dr. Costanzo speak a little bit about the food services that we have set up at different sites throughout the district. As one of the items that one of the things that we're doing to support our families.
Sure. So we have a number of food sites located throughout the city. Ben Franklin, Brian McMahon High School, Central Kitchen, Colonial Village. We have East Norwalk Library, Jefferson Elementary School, Nathan Hale, the South Norwalk Community Center, and St. Philip's Church. Each day between the hours of 12 and 2, these centers are open and available for any individual between the ages of 2 and 18 years old. They don't need to be a Norwalk Public School student. They just need to meet that age criteria. And breakfast and lunch is available for them. Additionally, we have a couple of sites that are open 3:30 to 5:30. I believe Central Kitchen is one, Brian McMahon High School is the other. And with this set of 9 locations, we are currently in the process of putting together a plan in the event that there was some sort of a need to go full remote. We would expand the food distribution sites from 9 to 14. And we would work with Lamond and his team to find areas in the city that are, higher in population density and in areas that are walkable for families. This was something that we utilized during the spring and summer months. And it's made a big difference, I think, for families throughout Norwalk. So far this school year, the district has served about 365,000 meals, including breakfast and lunch, to students in the school system. And the USDA has allowed us to serve meals free of charge to all of our students this school year.
And Frank, if I could just add, just want to remind our viewers, and again, pass this on to your neighbors and friends, no questions asked. You can come, you say how many kids, we will give you the food based on what you share. We don't ask for any identification or any papers, as has been portrayed in the community. That is false information. Thank you.
Great. Again, several questions are coming through the Q&A, which is great. Keep them coming. Several questions have come in the area of our teachers, the staff, and in the area of what I'll say that's been quoted as staff fatigue. Any comments related to what is being looked at or any steps that will be taking to address this topic of, I'll say, staff fatigue?
So we acknowledge that our teachers are working extremely hard to ensure that our students are getting what they need day in, day out. Like I articulated at our board meeting earlier this week, we are so thankful for all the work that our teachers are doing. We've been working with the Department of Guidance, the guidance department within the district, to offer mindfulness and meditation sessions for our staff. We launched a session during the professional development day that we had earlier this week during the election day. And several of our staff participated and really felt that they benefit from the opportunity to have a time just to relax, meditate, practice breathing techniques that help them get through the day and through the stresses of the work that they have to do in the midst of the pandemic. We've organized a series that we're in the process of launching, where at least once a week we will be offering mindfulness sessions that will be hosted by some of our guidance team members or psychologists within the district to support our teachers through some of these challenges. We've also organized time on Mondays for teachers to have time to engage and collaborate with one another so that they have an opportunity to, one, share best practices with each other, but also have some time to think and reflect about the work and have an opportunity to plan and develop things that, the things that they need to do to continue to support our children. And I have to reiterate, I know the work is not easy. Our teachers are working exceptionally well. The times that I've visited schools, I've seen amazing things happening. Teachers have been extremely creative in developing programming structures that support our students. And I know in many cases, they might not feel that they're doing enough, but they're doing incredible work to ensure that our students are successful. And we, like I articulated during the PD Day, they are our heroes. And a lot of times, you know, we hear about our nurses and doctors being heroes. Our teachers are our heroes. They've been doing phenomenal work for our children. And we're hoping that through the mindfulness sessions that we are offering, we give them an opportunity to kind of release some of the stresses that the pandemic has created for all of us.
Thank you. Any other comments on that area? I don't know, Mayor Rilling, I don't know if you want to comment on the city side in terms of the outstanding work that's being done by the city staff.
Yeah, thank you, Mr. Burnett. Absolutely. The two hardest working people I have right on here are Lamond and Deanna. They are working 7 days a week. We're talking on the phone at 8, 9, 10 o'clock at night, early in the morning, meetings all the time, conference calls. But you know what? Everybody at City Hall is working hard. City Hall, contrary to what some people may say, City Hall services have never been shut down. We've always provided the essential services. We've always had staff in City Hall. What we've tried to do is rotate staff so that we don't have an entire department being exposed and having to quarantine and not being able to work. Some people are working from home and they're expected and they're performing and they're doing what they have to do, and they're being productive and required to work a full day. But we also have in the city of Norwalk a very effective employee assistance program where people who are feeling stressed, feeling fatigued, can get assistance, can reach out. It's confidential. And I just sent out an email to all the city employees today, not only thanking them for what they're doing, but also for letting them know that if they do feel they need assistance, please reach out. But that goes for everybody. You know, not just City Hall employees, not just for the teachers. Everybody in this situation is feeling stressed. So people need to understand that if they're feeling that they're not able to cope, that they're not able to, if they're feeling overly stressed, reach out, get the help that's available. You can reach out through our city to find out where services may be available, through 211, other places where they can get the help that they need. But yes, we do provide assistance for our employees. We do reach out to them. We do communicate on a regular basis, and we do stress the fact that if you're feeling that you're unable to cope, please reach out and get the help that we can make available to you.
Great, thank you.
Greg, can I just add to the mayor's comments?
Absolutely, thank you.
So on the health department's webpage, if you go to norwalkt.org/coronavirus, we have a subpage called Take Care of Ourselves and Our Loved Ones. And we have a section there about maintaining our mental and emotional health. And one of the resources that we link to is the Family and Children's Agency Crisis Counselor Program. So if you've been affected by COVID-19, which all of us have, right? We're living through it. You can call them to speak to someone to help you through it. But there are also several other mental health and wellness resources listed on our website if anyone wants to look to see them. Thank you.
Great, thank you. Several questions are coming through, going back to Ralph, in terms of security, online security, and what plans do we have or protocols do we have in place to address Chromebooks possibly being hacked and just online security, especially in the event that we go to full remote?
Sure. Well, our environment, both our Office 365 and Google environment, are tied down to our students and to our staff. So, you know, we don't allow other people into it. So from a from a standpoint of student data, we've got that locked down. We also use tools on we have filters that are set up for students when they actually have computers at home. The filter that we use is called Securely. And especially on our Chromebooks, if you go to that mpsparentuniversity.org, we actually had a workshop earlier this month, the end of October, around how parents can actually see exactly what their students are doing online by logging in as well too. So parents can actually have access to that information. But we do filter our data. We make sure that students stay safe. It's a legal compliance that we have to have in place as well whenever we do this type of work. But our Google environments and stuff are really locked down to our own students and to our staff.
Great, thank you. Another question has come in related to snow days, and this is getting very specific, but what's the plan for snow days? Any responses on that?
So we haven't yet made a determination in terms of how we will proceed around snow days. The one thing I can say that it's very easy to, if we don't have power outages, to transition learning to remote now that every child has a device. But we have not yet decided or discussed what we will do if there is a snow day in terms of transitioning to full remote or not. Our biggest challenge is that usually when there's a storm, we have power outages, and that creates challenges for certain students to have connectivity as well as staff.
Great. Any other comments related to that? Okay. We still have several questions coming in. We're trying to field as many as we can as they come in, but they're touching on so many different aspects of this whole COVID situation. One of the questions, several questions have come in related to transmission, and specifically, it reads, do we have any evidence of COVID actually being transmitted within the school system?
So in terms of transmitted within the school system, it's very hard to determine where somebody has been, contacted the virus, because even though some people are in schools, they're also engaged in other activities that could have led to getting infected with COVID. When we have a positive case, we try to immediately quarantine those associated, and we can really determine with certainty whether there has been school-based transmission or not. I don't know if Deanna wants to speak more to that piece, because we've been collaborating in identifying the positive cases and then working with Joanna and Frank's team to engage in the contact tracing and quarantining process.
So recently you've been speaking with the school nurses, talking about that, and I'm just wanting to do, making sure we're doing a comprehensive review and looking at all of that. And so right now we're collecting more of that information about the different cases within the school, so that, we can look at all of that. So we're currently looking into that. Joanne, I don't know if you have anything to add.
Up to this point, we've really had, most of our cases have come from out of the school, actually, parties, ball games, just not really doing the social distancing. We are looking at a few cases that may possibly be transmitted within the schools, but we are still working on getting documentation of that, one or two at the moment. We've had more of an uptick, obviously, in the last couple of weeks, just as the entire city of Norwalk has had, and the entire state has had. But certainly, considering we have almost 12,000 students, we don't have anywhere near that number. Brenda Wilcox-Williams has our dashboard up, which is changed every week, of the amount of students that are positive, staff, and then people that are quarantined. We have our nurses that are sending out students that may be suspected of having COVID. And by the way, our nurses have received a lot of pushback from parents, and I understand this. A year ago, if a student came into our health office with a headache, what we would first do, obviously, is take their temperature, do an assessment. If we couldn't really find anything, we'd give them some water, have them lie down, give them an ice pack, go to rest for a little bit, and go back to class. I think parents need to understand we are following Addendum 5, which is the guidelines for school reopening, and it's the Connecticut State Department of Education, and also the CDC website. Any single type of a symptom can be COVID. I can't discern whether or not this child's headache is COVID or whether it's something else. So when we call a parent to pick up their child, sometimes, they're at work, they're very upset. My kid has a headache. Why are you calling me? We're really trying to keep everybody safe. That's what this is all about. And we have to do that because that's what our executive order is. So I just wanted parents to understand that. We sent home 136 students this week that have come in with either runny nose, a cold. Well, we don't know if it's an allergy or if it's a cold. And many of our doctors don't know that either, unless the student is tested. So we can't discern that. It's not something that we can say, yep, it's an allergy, go back to class. Because if it's not an allergy, we've just infected that entire classroom. So that's why we have an isolation area for these children to be picked up. And I do feel the need to let parents know that we are really not trying to get people out of work. That's not what this is about. You know, we're trying to work well with our parents as best we can. Our jobs as school nurses is to promote learning and to keep our kids in the classroom. That's what we're trying to do. And now, you know, whatever little type of situation they have could be COVID, including conjunctivitis. The old pink eye, that could be COVID at this point, you know? So I just like to ask a little bit of cooperation from parents and just to have them understand why we're doing this. We're not trying to get people out of work and trying to have them come pick up their kids. We're trying to keep the kids in school where they belong so that they can learn. That's what our job is.
I just want to add, so one of the first things that I do in the morning is I look at the cases and I pinpoint the ones that are of childhood age, and I call over right to the schools and we go over cases and we talk about, all right, is this person in person? Is this person not even within the district? Are they remote? And so we continue to find several cases that are children that are on, you know, full remote. So it really is, you know, a mixture of what we're seeing in the community. You know, it's a reflection of what's going on in the community.
Thank you. Information is so vital, especially during this current COVID situation. If we can expand on what is being done to provide information to the community and where can they get that information? Let's see.
I can start out with that, Mr.
Yes,
Burnett.
thank you.
We send out a daily briefing every single day. There's no lack of information. We put out press releases. There's 211. There's just any type of information that anybody needs is available. We put out information about testing centers. We put out information about new cases within the city. There's a state of Connecticut has a wealth of information relative to the current situation. So if anybody has any questions as to where they would go to find a certain specific information, they certainly can call my office. They can call the health department. They can call Mr. Daniels. We have a tremendous amount of information. I know the school district puts out information, and I'll let them expound upon that, maybe Ms. Williams, about the information that the school district puts out and sends home to the parents. But we're constantly looking for ways, and that's a topic of conversation right now that we're having with the Common Council, as you know, as to how we might be able to give more information, not just during the time of COVID, but at a time when things are more normal, that just kinds of information that people know where they can go for services, where they can go for help. And by the way, we put out a briefing 7 days a week. I think we're the only city in the state of Connecticut that puts out a briefing 7 days a week. And poor Deanna is exhausted because she has to search the numbers and get the information, so I can include that in my daily briefing.
From the school side, as the mayor referenced, we do also put out a lot of information pretty much on a 7-day basis as well. A lot of it is on our website. We do have, as Joanne mentioned, we have the COVID dashboard that consolidates all of the district-wide information in one place, because we were getting a lot of people asking those questions, but we didn't want to keep pinging everybody's email inbox with district-wide information that wasn't relevant to them. We also added, in response to questions from parents, a school status tracker, so that if a school is out on a 2-week closure due to quarantines or due to the lack of staff, people would be able to check there and see when a school would be open. But that information is also being communicated through other means direct to people who are impacted as well. So that's not the only source if you are impacted. For anybody who's impacted, they will either get a phone call from the nursing staff or the administrators, as Joanne mentioned earlier. Once those calls are complete, the staff will be notified, and then the principals will also send out to the entire school community to let people know that a confirmed case has occurred, to let them know who will be quarantined and any other relevant information about that particular building. So that is going out on a regular basis as well. So we put everything out on social media as well. And we do have both an internal and our external district newsletters that go out every 2 weeks and have a ton of information in them as well. We do want to make sure that parents and families keep their information up to date at all times in our Power School system. It's very important so that our nurses can reach you if they need to, but also that you get any urgent notifications this year, not weather notifications necessarily all the time, but if there's any other notifications as well. So if you do need to update your information, please make sure to do so. You do that through your school office, through your principal's office, and make sure that they've got your email and that they've also got an active live cell phone for parents and guardians so that we can reach you whenever we need to. And then last but not least, I just want to make mention of one other thing. Joanne touched upon parents and parents who are working, and we are really, really aware of the stress that this puts on working parents. It's a very difficult situation. We certainly know that. I wanted to make sure that you're aware that if you are a parent and you are struggling with the need to have a child at home and you need to notify your employer that this is the situation, please contact your principal. There is a letter available that can be signed by the principal and by the nursing staff that you can then take to your employer so that you can verify that your child is home or under quarantine. And that may help you in terms of your communication with your employer. And we just wanted to let you know that was available. So.
Any other comments related to communication and getting information out? One area, especially, we have the holidays coming up. What are we suggesting? What are we telling? What's the messaging for the upcoming holiday?
Deanna or Lamont, maybe you can handle that, because right now we're recommending a whole completely different level of gatherings at holiday this time. The state is putting out guidelines. Deanna or Lamont, you want to expound upon that a little bit?
Yeah, I'll mention this, Dan, then you can take it, because I've been at the sites, and one of the things that we've heard or experienced, that again, this false pretense that if I'm tested negative, then I can go to my Thanksgiving activities, and that's just not the case. So again, I just want to caution our residents that their motivation to be tested so they can interact, and we just want to be careful with that. And I'm going to ask Deanne if she can kind of connect the dots for us, because that's one thing we've observed at the testing site at Vets Park today. While I appreciate people being honest and sharing that information with me, I'm like, that's not the reason why you should be getting tested. Danny, you want to take it away for us?
Yeah, so I mean, I'm gonna say the first thing is to wear a mask, right? So I mean, that's the message, right? So the CDC just put up updated guidance related to Thanksgiving, related to travel. You know, certainly traveling can increase your risk of contracting the virus. And you have to really think about, you know, who we really want to be staying with people that are in your own households, because we're seeing, you know, a lot of spread with like small gatherings. You know, you're around your family and your friends, and you trust them, of course, because they're your family and your friends. But that's one way that this virus is spreading, is, you know, you tend to like let your guard down, right, when you're at home or when you're with people that you're close to. But you have to continue to wear a mask. You have to continue to keep your distance. You know, you shouldn't be within, you know, 6 feet of somebody who's not within your households. And, you know, it's certain, you know, all those same messages about washing your hands, really thinking about, there are ways that if you do attend, smaller gatherings, there are ways to mitigate some, to lessen some of that risk, but really it's to, just be very careful now. And of course it's extremely hard. But we can circulate some of that guidance that the CDC has. But one more thing I'll say is to do something virtual, right? To have a Zoom, to see if you can do a Zoom with family as, as a way to connect with some of your relatives if you're unable, to see them, to look for safer ways to celebrate the holidays.
And Deanna, I know on our Fridays calls, I always ask you to expound on this because, I think Mayor Rowland mentioned it. The health department receives every COVID report in our city, and we can track it. And what we do know is that it's households. So mom, dad, siblings, aunts, uncles that all live in that residence. So to Deanna's point around Thanksgiving, we're going to have to just figure out and encourage you all, like we here in the panel is going to have to do some things differently so that we can all stay safe. And that's just very important. Deanna, can you just talk about kind of when you ran the numbers, how it's about households that are getting really impacted, family members that know each other?
Sure. Yeah. So we see a lot of people within the same household spreading it to each other because, those are people that are within close contact with each other. But it could be somebody within one household who goes to another household. Like I said, it could be a close friend, or it could be a family member, or it could be a cousin or something. You're going and some of you are getting together, and it could spread that way. And then you could bring it back to your household and spread it to your loved ones. So we continue to see, close contacts of families within, households ending up positive themselves.
Yeah, it's important to remind folks. It's people who you know. That's what the data is telling us.
So as we look at the public schools coming off of the holiday, do we have a strategy? Is there a plan that we want to share, or how do we address this situation that we can't control who goes where? So what will Monday look like?
So obviously, those individuals that decide to travel will have to provide a COVID test upon their return. If they're traveling to one of the state restricted states, it's one of the factors that we're going to be looking at and monitoring. We're looking forward to opening up on Monday, unless there's a school that is in quarantine because of prior tests, because we have some schools right now that are full remote even past Thanksgiving, after the Thanksgiving holiday. So we will just continue to closely monitor any positive cases and the trends in the schools and staffing. And usually we use staffing as part of the factors to determine whether or not we need to close down a school, besides looking at the number of positive cases as well.
Okay, great. Still looking, questions are still coming in. Quite a few are coming in. Couple of questions have come in related to students wearing masks. What's our protocol there? How do we handle that if they're not wearing their mask appropriately? I would assume that means maybe they have it on and not cover their nose. As Lamont said, it's important to cover your entire face, including your nose. So how is that being addressed in the school system?
So we've had a lot of conversations about wearing your mask at all times. I know teachers have been very proactive in ensuring that students have their mask on. We constantly remind students about putting their masks, making sure that their masks are on properly. I haven't heard, and Frank, you can chime in if you wish, any major concern about students wearing their masks in school. we do provide breaks throughout the day to ensure that students have an opportunity to have some like rest time without the mask on as well.
Yeah, that all seems very accurate. We have not had many instances of principals that have reached out to central office with concerns about students refusing to wear masks. Administrators and teachers have done an outstanding job at transitioning students into this new way of life for the time being. And it's also a challenge for staff who are on their feet all day and doing a lot of walking around. But as the superintendent said, each school has built-in opportunities for mask breaks, but we take the mask policy very seriously, and we think it's really helped us mitigate spread in the schools.
Joanne, Deanna, any thoughts about the mask?
I think the kids are doing great in school with their masks. I mean, the kids really, even if they don't keep it above their nose, it's a teachable moment. And that's when the teacher just kind of, tells them to put the mask on correctly. Most of the kids are great. We really have not had a lot of kids that don't want to wear masks in school. They get their breaks. They have some recess outside. I think they model the behavior also of everybody else. So everybody's wearing a mask, so I should be wearing my mask as well. The other thing is about masks, the one issue that is not allowed in school is the mask that has the exhalation valve on the outside. That is not allowed. And that's by the CDC and also our Connecticut State Department of Education reopen guidelines. So they do require a face covering that covers the nose and the mouth area, but not that valve, because that's actually taking your germs and spreading it around. So we don't want that. It's almost like keep your germs to yourself. If everybody wore a mask, we'd all have our own germs, right? For the better part, and try and keep everybody safe.
Deanna, any comments on that?
Just
Okay.
wear your mask, wear your face covering.
Wear your mask. Great. We're still getting questions coming in, especially related to closing the schools. And I know we've touched on that, but maybe it's important to reiterate the thinking that goes into going to full remote learning, just so that everyone's clear, because still getting several questions about, are we going to full remote? What are we thinking about? The number of cases are continuing to increase. Can we just touch on that once again?
So at the governor's address recently this week, he spoke about the urgency of keeping schools open and looking at other mitigating factors to take into consideration so that we can ensure that our schools stay open. We've been looking at, like I articulated earlier, the number of COVID tests within a particular site. We've had to mainly close down sites, mainly because of staffing and not having enough staff to cover the programming needs of the school. I'll have Frank speak a little bit more in terms of his team and the initial steps that are taken before we make a determination of whether or not to close down a site.
One of the important factors in making a decision, or the ability to make a decision, is the timing for when a new positive case comes to the attention of the Department of Public Health and our health coordinating office. When we get a new positive COVID case late in the evening, past the time when we can begin the contact tracing period, simply because we can't make phone calls home to families at 10, 11, 12 o'clock in the evening. We've made the hard decision to close down the school the following day, assess the situation. Deanna and Joanne worked together with that school's nurse, that school's principal, and the contact tracing occurs over the period of the several hours from the time that we get up and get the day started. And that is more typical than you would think, because what we're seeing more often are individuals who, out of an abundance of caution, are reporting their test result to Joanne before the Department of Health gets that report. And sometimes it comes in the form of a picture that's sent from one phone to another. Joanne can take a look at it and get a good indication about the authenticity of it. And it's actually helped us a number of times where we were able to get a jump start on the contact tracing and be able to make a decision about closing schools based upon the outcome of that contact tracing. We've had positive COVID cases that have had zero exposures in the finding, because either the student was remote or the individual who tested positive has been out of the school for several days for whatever reason, calendar reason. And it's allowed us to not need to quarantine anybody in the school. But that is not always the case. And depending upon the individual and the amount of square footage they cover in a given day, it can mean really expansive exposure numbers. And as the superintendent alluded to earlier, we've really taken a very liberal approach at quarantining people who we think, are anywhere near a positive person, going well beyond the 6-foot social distance guideline. Taking cohorts of students offline and teacher teams if we feel that there's reason to do so. And closures, I'll say as a closing point, have a lot to do with the principal's input into the situation and our HR office's ability to be able to staff that school in the event that we have a large number of adults who need to be quarantined. And that's really been the reason for the closures. It hasn't been because we're concerned that we have COVID spreading in any one particular school. It's been because we simply don't have enough manpower at a school after we've had a couple of positive cases and we've had scores of staff come offline for a period of time. We switched the school to full remote, and we give the school a new return date. We've had about a dozen cases like this since we reopened in September. But we've been able to maintain keeping the school district open, and we're proud of that.
Thank you. I think it goes without saying that this has been an unusual school year. That's completely an understatement. So as a result of that, so what are we doing as it relates to testing, grades, assessments, et cetera, during this particular COVID timeframe?
So the schools have their grading policy, and we've continued to adopt a grade bracing approach that was in place in March when the pandemic initiated. And obviously, there's been more project-based and activity-based methods of determining performance more than there have been actual tests, because of the fact that kids that are at home, you can't set the same parameters of those that are in person. So I know that teachers have modified in many cases the way that they're administering tasks to assess how well students are understanding the content. We can definitely have the chief academic officer put out some information if there are questions around that, to provide more clarity around the grading structure to the community in the upcoming days, so that they understand the format and how the grades are being monitored and reviewed.
Great. So the governor has come down with several executive orders during this pandemic. What is the city and the Board of Ed doing to ensure compliance with the governor's executive orders? And Mayor Rilling, maybe you want to begin the response to that?
Yes, thank you, Mr. Burnett. We do random spot checks, mainly on some of the restaurants and other places where there's likely going to be large gatherings. We have an enforcement process in place. One of the things that people might want to know is if you see a violation or what you think is a violation of a governor's executive order, or you think there's a situation that appears dangerous and likely to spread the virus, you can call our offices. You can call my office, reach out through the customer service department, leave a message, or send an email, and let us know where you've seen something that concerns you. I get them all the time. I'll reach out now. The health department, under the direction of Deanna, has an inspection team that goes out. They work with the police department very closely, and we take enforcement action where we find it necessary. When we look at some of the larger stores that people were concerned about early on in the pandemic, we reached out to the chief executive officers or the main offices, the headquarters offices of ShopRite, Stop and Shop, Costco, Stu Leonard's, Walmart. And we had conversations with them and gave them ideas as to how they can make their environment safe. We had them start counting people when they go in and making people queue up outside rather than crowd the stores inside. So those are the things that we do. We do the random inspections. We go through on a Friday or Saturday night. A police officer and an inspector from the health department might go out and check on several restaurants to make sure that they're serving properly, that they're not just serving alcohol, that they're serving food along with the alcohol, that they're keeping the social distancing. But the key here is the public becomes our ears and our eyes. We're not every place, nor can we be. I go out and about. I don't go into a lot of stores. I try not to, except to do shopping and things. But I drive around and I try to see if I'm looking at anything that concerns me. So we rely on the public to let us know that they've seen something that might not be right. And we'll go and check it out. And if necessary, we'll take enforcement action. Deanna or Lamond, you might want to add something to that.
You said it perfectly, Mayor. You covered it great.
Oh, you want a pay raise?
I concur.
Any comments related to compliance within the Board of Education?
So we have ongoing conversations and calls with state officials in monitoring monitoring the cases within our schools, and also just gauging their thinking around the work. As I articulated earlier, the governor has a commitment of keeping our schools open. The commissioner has articulated the same, and our focus has been to ensure that we're setting clear safety protocols within the schools to ensure that we continue to provide the best possible environments in terms of safety and security for our kids and staff, so that if we have to contact trace or engage in any processes to identify a case, we can do that, but we try our best to ensure that we can keep our schools open whenever possible. And we've taken the approach of quarantining schools for 14 days rather than shutting down the system at large.
Great, thank you. Any other comments related to compliance to the governor's executive orders? Okay. Let's go back to the Q&As, and we have about 9 minutes left till the top of the hour, and we still have questions coming in. We've covered quite a few of the questions, and some are rather specific, and we're not going to get into specific individual situations. Here's a rather interesting question related to vaccines. Any thought about what is our approach going to be once there is a vaccine available? Or will we be putting in any requirements for all students to get the vaccine? I'll just pause there to see what are some of the thoughts or thinking around a possible vaccine.
So I'll start. In terms of the vaccine, we know that we're hopeful that we'll start to see some availability of vaccine next month, starting off in very limited supplies. But it's really going to be focused in certain areas and certain target populations at the beginning. We're looking at, those who are in the critical workforce. These are all things that are being worked upon right now at the national and the state level about who's the priority. But thinking about like first responders, healthcare personnel, and then looking at other populations. So it's going to be a tiered approach. It's still going to be a while before it's available to everybody, to the general public. It might not be until the springtime, possibly, where it's more widespread available, but we're looking at it different timeframes and how we're going to vaccinate different target populations. And the health departments are certainly going to be part of the vaccination. Healthcare providers, obviously, there's going to be a lot of different partners that are going to be providing vaccinations to the different populations and to the public. So we're working on that now. We're also working really closely with other health departments in the region and the state health department to pool our resources together so that we can work, together on vaccination.
This is one of the few areas in the COVID conversation where there's a chance to see light at the end of the tunnel and be optimistic. There are several pharmaceutical companies that have produced a vaccine that has high effective rates, 95%, Pfizer and Moderna over the past few days. And it's really a matter, as Deanna said, producing this at scale and getting it out into the population. My understanding is that there isn't a vaccine right now that is likely to get approved for children 12 years of age and under. So when we do start to see the vaccine come to market, we're probably looking at, as Deanna said, essential employees, healthcare workers, first responders, and then folks, 13 years of age and up, but probably not our elementary school students.
And I think one of the biggest challenges now is going to be distribution. Where do they go, and how do we administer? A lot of the physicians will certainly have access to it, but there's going to be a huge demand for this. And the essential workers and essential teachers and first responders, medical professionals, they'll be getting it first. The medical professionals have been predicting since the beginning of this pandemic that there will be a second wave and a third wave, and perhaps this is going to be an annual thing. We don't know yet. This is a very unusual situation that we haven't seen before. So like I said early on, there's no manual on this. We're writing the manual every day, and we're trying to learn from our past experience. So the first wave gave us a lot of experience that we can use into the second wave. So, but dissemination and distribution and actually administering the vaccine is going to be a huge challenge. And we have to prepare for that.
Great. Thank you. Very really. So as we close this town hall meeting, there's still questions coming through the Q&A. So this might, let's say this is the close of town hall meeting number 1, because I think we need to have several more to continue to get information out to the community, in addition to the avenues that we're currently using. So as we come to a close, I'll ask Brenda Penn-Williams and Dr. Estrella and Mayor Rilling, if you have any closing thoughts before we bring town hall number 1 to a close.
Okay, thank you. Wow, 515 people. Wow, I mean, people were really, really excited about this and they wanted questions answered. That's a great thing. You all can just pat yourselves on the back, clap your hands, because we did a great job. Thank you so much. Thank you, thank you, thank you. And I want to especially thank the community members for sharing your thoughts and concerns about the ways to support our students and ensure the safety of our educators. Thank you, thank you, thank you. What happened was I text Mayor Rilling, Deanna, and Alex. And so Alex was the first person to say yes. Then I had to text Mayor Rilling. I'm like, and Lamont, do you want to do this or what? I haven't heard from you. I want to say thank you again, because this was very successful. So and Greg, you did a phenomenal job. So thank you. Thank everyone.
Thank you. Dr. Estrella, would you like to give some closing thoughts?
So I just want to thank Ms. Brenda Penn-Williams for allowing us to be in this conversation today, and for all the panelists that were here. It's evident that we are a team and we've been working really well together to ensure that the community as well as our schools are moving forward in the midst of this pandemic. I saw many of the questions, and we'll try to follow up with additional information to address some of the questions that might have not been answered tonight. I know that the work is not easy. I know that people are tirelessly working, and I want to thank everyone for everything that they're doing, because I know that it's not easy in the midst of everything that's going on. And we're going to get through this together, and for the betterment of our community, for our children, and for everyone involved. Thank you for everything you're doing. And thank you, Greg, for being a great moderator, sorry.
Yes, and I want to thank Brenda Penn-Williams as well. Thank everybody on the panel. I think the response from the community shows just how serious this situation is. And we did have a town hall meeting several months ago, but I think, Greg, you're absolutely spot on. We need to do this more frequently, and focus, maybe perhaps different focal points that we're looking at in any one of them. But I want the public to know one thing. First and foremost in everybody's mind is the safety and health and protection of our community, of our teachers, of our students, of our first responders, of our medical professionals, everybody in the community we are here to protect. And we will make whatever decisions we need to make in order to make sure that we do protect our citizens. The decisions are not easy, but they have to be made. We are in a position where we have to make those decisions. It may not always be popular, but I want everybody to know that any decision we make will be made with the mindset of keeping our community safe. So again, thank you, Greg. You did a great job. Thank you, everybody, for being here. Thank Lamond and Deanna from my staff and Dr. Estrella's staff. Thank you.
Great. Thank you, Mary, really. Well, we really hope that the community has found this town hall to be helpful. So as we close at the top of the hour, we wish you have an enjoyable rest of the evening, an enjoyable Thanksgiving holiday, and most importantly, stay safe and stay well. So at this point, we will sign off, and thank you to all of the panelists. Did a great job.